morning, students, and good morning, everyone. As introduced, my name is Nomusa Mkhwanazi. I'm the nurse at the MUT clinic. Our role is to support Goal 5 of the University Strategic Plan. We strive to provide an enabling environment to students. So, as students, one of the things that might not make you achieve your academic performance well is becoming ill. So that is why we have the clinic on campus to make sure that students' health needs are taken care of. I'll begin by defining health according to the World Organization. Health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of the disease. So that's a very broad definition, which encompasses health as in financial health, physical health, mental health, and social well-being, which talks to a lot of stuff around young people. Mental health, for instance, is a problem mostly for young people. It does not only affect young people, but it does affect older people as well. But these days, it's common amongst the young population. So your social well-being is important. That's the details of mental health and social health, I think, will be covered or have been covered by student counseling. But it talks about, for social well-being, for instance, talk about relationships. As a student, you need to develop healthy relationships, whether it's with your co-students or it's relationship as in personal relationships, so that you can have an all-rounded health and wellness. Who are we? We are a health and wellness facility on campus. We promote and provide preventative and curative clinical services. Our mission is to promote health and well-being of the MUT students and staff. Our vision is to be one of the best university health and wellness facilities. It's a very ambitious vision. Our objectives and goals and objectives are as follows. Our goal is to have a health and wellness conscious community. By the time you finish your studies at MUT, you need to be health and wellness conscious, because it's very important, because some of you are going to come out of the university and be leaders. And for people to work and perform their work assignments, they need to be healthy. It would be useless to come out and neglect your health, because you might not be productive for a long time due to illness. Our objectives include the following: to provide quality client-centered service. So it's important that you tell us what you require, some of the services that we might not provide. We may not be able to provide all of them, but we'll try our best to listen to your concerns, listen to your requests. We want to improve access to service. We do this by partnering with other health services around us, because we're a small facility with limitations as to what services we can provide, and we have limited human resource capacity as well. So we partner with other service providers like the non-governmental organizations and the government and the municipality of eThekwini. We want to increase health promotion and disease prevention. We want to improve quality and safety of our clients. Currently, during the COVID-19, we screen everyone that comes to the clinic. We have to make sure that you do not go to the clinic for a health prevention service or for a non-illness service, and then you come back infected with infectious disease. So we are very strict with the screening before one enters the clinic. Our values: we are compassionate, we have passion for what we do, we believe in honesty, integrity, and we respect human dignity, and we are service orientated. Our approach, we try and be as comprehensive as much as we can, based on what we are allowed to do, because we are not a fully fledged primary healthcare service. There are services that we are not able to do. but we try to be as comprehensive as possible. Our service is integrated. We have primary health care and HIV services and health promotion and occupational health under one roof. We use a multidisciplinary approach. I've mentioned that we partner with other health and related stakeholders. What services do we offer? We try to be relevant to the student population as much as we can. We do provide services for the staff, but our service is mainly for students because the staff are on medical aid and they have their private medical practitioner. We provide primary health care, which is the treatment of minor ailments, namely headache, flu, period pain, etc. We provide chronic disease management of what we are allowed to. So if you already have a chronic medical condition, go to the clinic, let us know. If we do not provide that medication or it's out of scope, we will then refer you to the service providers around us. We do NSFAS support for students with medical disability. We do assessment for students and assist with the filling and the application of the medical disability NSFAS for those that qualify. It's not everyone who qualifies. There are conditions that has to be made that are prescribed by NSFAS, not by us. We also have a human immune virus and acquired immune deficiency syndrome services. We do the HIV counseling and testing. It's in progress. It started this week. You might have seen people in the memory lane doing some testing. You can go to the clinic and test for HIV and AIDS. We provide the treatment care and support for those students that have tested positive. We support them. Currently, we do not provide ARVs, but we have a relationship with the facilities around us, like Prince Mshini, D Clinic, and Ithemba, which is an NGO that provide the support for treatment and for HIV. We have a peer education program. HIV is not a new disease anymore, but there are still people that do not understand the facts and the basics around HIV. So the peer education program is a student volunteer program where we request students that are interested in educating other students about HIV to volunteer, and we arrange for them to be trained and we support them so that they can do the peer-to-peer education to other students. The clinic has got few staff members. We might not be able to reach the 12,000, close to 13,000 students on campus. So please, if you can, volunteer and you feel you will be able to do this work, you are more than welcome to involve the clinic, and then we will take you through the process of being a peer educator. We distribute condom for free. We get them from the Department of Health and Higher Health, which is an NGO that works with the Department of Higher Education. They provide us with condoms, so they're freely available in the clinic. There's no excuse not to use them or have them. On top of that, we also provide the lubricants. Lubricants, the main intention for them are for men having sex with men because of the nature of their sexual activity. But we do give to other students as well. Other services that we offer, young people are sexually active, it's their prime time to be so, hormones are up at this level. So we provide the fertility control medications. I don't want to call them family planning because I do not believe a 19-year-old is planning a family. A 19-year-old or a 23-year-old at MUT is here to study. So what we do, we provide this fertility control treatments. I'll give the details. And we do pregnancy testing. We treat the sexually transmissible infections. It is unfortunate that they tend to be more prevalent among young people, but we do have the treatment for prevention. I've mentioned that we offer free condoms, and we promote voluntary male medical circumcision. there's enough research that supports that people or males that are circumcised are less likely to be infected with HIV virus. It does not completely remove the risk, but it minimizes the risk. So if you are interested in doing the voluntary male medical circumcision, if you have not already done so, we can arrange for that. We've got partners because the government has given it to the NGOs, so there's quite a few NGOs in our close proximity that do this circumcision. And then we do occupational health, which is mainly for the staff. We do hazard identification and risk assessments. We do medical surveillance and biological monitoring for those that are exposed to hazards that we can measure and be able to manage the impact of their work exposures. And another service that we do is health promotion and disease prevention. Prevention is easier than treating. It's even cheaper. So we try to create awareness on campus and in the residences. You will get invites or you'll see notices about health talks that are being conducted by peer educators, both on campus and in the residences. Please do attend, because there's lots of things that you can learn from there, because during the consultation when you're in the clinic, usually you are attended by somebody who's older than you. Some of the questions you might feel uncomfortable to ask, and yet if you meet as a group of peers, you ask questions very comfortably, and if the peer educator doesn't know the answer, the peer educator will verify with the clinic and you'll get proper information. We do immunizations mainly for the biomed students, but we do provide flu vaccines for those that are interested in taking flu vaccines. We encourage them more to those students that have chronic medical conditions like upper respiratory conditions, and those that have got diabetes and other medical conditions, including it being HIV positive. Available family planning methods. Abstinence is the most reliable option, but everybody has a choice. You are now young adults, you choose to do what you would like to do. So we provide condoms, we provide injections, we provide pills. We also provide the emergency contraceptive pill, which is known as the morning after. That perhaps you had not planned to have sexual intercourse and you find yourself in that situation. Within 72 hours, you still have an option of taking this pill. Unfortunately, they expire in the clinic. Students are not using this service, I'm not sure why, because those tablets are available for free. We also have the implant on the one that you put on your arm, which lasts for 3 years. So if you opt for that one, it's easy. You'll go to the clinic once and then you will be set up. We'll set for the 3 years until you finish your diploma. There's also an option of an abortion or termination of pregnancy. We do not do it on campus, but we do refer students to the facilities at Prince Mkhwanazi and Eddington Hospital, where they do the termination of pregnancy. There are details like, for instance, we have to be less than 20 weeks and so on. And we strongly encourage students that want to terminate pregnancy to go for counseling. We cannot force them, but we do refer them to student counseling so that they are mentally ready for the procedure. It is important to know that not everyone is suited by the contraceptive options. So you might try an injection and then find that it doesn't suit you. Don't stop. Perhaps try some pills. You might find that the pills A do not help you, then you go to other type of pills, because there's different combinations of pills that we use. So do not just stay and fall pregnant unexpectedly. Pregnancy has to be planned because it's got cost, social, financial, and it can disturb your studies as well. Under the HIV and AIDS program, we follow the Higher Health program. Higher Health is an NGO for health services, health and wellness that works with the Department of Higher Education. So they provide us with some funding to complement what the university budget has approved for us for the HIV and AIDS program. So under this we have the prevention, which is HIV counseling and testing and condom program. We also have the masculinity or Brothers for Life program, where peer educators invite males. We have male peer educators as well. So young males to talk to each other about manhood. We see a lot of gender-based violence, mostly against women. So we try and encourage young men to attend these sessions. We get people from outside to give motivation and insight around masculinity. What does it mean to be a man? We describe being a man more mainly by having 5 girlfriends on campus and making 3 of them pregnant. So we try and empower young men on manhood, and do the same thing for girls and young women under the ZAZI program. Substance abuse is in the rise amongst young people, so we do create substance and alcohol abuse awareness. So if you attend those talks, you will gain a lot of knowledge as well, and you'll be able to make informed decisions, because if you're not adequately informed about a condition, you might make uninformed decisions and perhaps get yourself in a situation that is not very pleasant. So within these awareness programs, we also deal with stigma and discrimination. There's stigma against people that are HIV positive, people that have tested Covid positive, people with living with disabilities. So as a university, we discriminate stigma, and as campus health, we then work towards that goal of making sure that we have an environment that is free from stigma and discrimination. We do HIV counseling and testing, peer educator program, condom distribution, care and support. I've spoken about that. And we take special notes of the key populations, the men having sex with men. It's a reality that we live with. Perhaps some would like to take it away. People have got different opinions about that, but that's a reality for people. There are women who have sex with women, and then there is a group of people under the lesbian, bisexual, gay, transgender, intersex, and queer. So we make sure that when they consult the clinic, we don't discriminate them because of that. And we encourage everyone not to discriminate other students because of their sexual orientation and sexual preference. We function under a legal framework. So we have a permit for us to have a campus clinic. That is why we have limitations of what we can do and we can't do. We have a license under Section 22A of the Medicines Related and Substances Act. We are also guided by the scope of practice for nurses under Section 38A of the Nursing Act. So that is what guides our resource. What to expect during consultations? We deal with history taking. We need like the signs and symptoms. You have to narrate them accurately and clear and give details. Some of the questions might feel very personal. Like for instance, if you have sexual and reproductive complaints, then some of the questions will really get personal. It's not that we are prying. We want to make sure that we get an accurate diagnosis. Like for instance, if we come with an STI and we get treated for an STI, you'll be asked about the number of partners that we have, because once the nurse has treated you for an STI, she has to give you a card for all the sexual partners to go to their facilities and get treated. Otherwise, it's a waste of treatment, because if you get treated and you go back to the partner that is infected, you're going to get reinfected again. You don't get immunity through treatment. So we need to know the onset of the symptoms, the duration, your personal and family history, as well as clearly defined signs and symptoms. Common medical conditions that we treat on campus is upper respiratory infections, sexually transmittable infections, athlete's feet, and we do the investigation. For instance, if we see many athlete feet problems, we then investigate where the students stay, because sometimes it's associated with poor cleanliness in the residences. So we would like to, if you come in with athlete's feet, we'll ask you about where you stay and the name of the residence if you're staying in the residence, and then we'll do an investigation and liaise with the housing officials. We treat abscesses, mainly the armpit abscesses, which are associated with some antiperspirant. I'm not going to name them here because it's people's business, but yeah, they do appear, and some of them are too big for us to treat. We do give antibiotics where possible, but if it's too big, we refer to the facilities where they can be incised and drained. We treat dental caries, ear infections, pink eye, itching eyes, hemorrhoids and piles or piles. So with hemorrhoids and piles also it becomes a problem, especially for males, because one of the questions we have to ask is your sexual orientation, your sexual preference. Because sometimes you might have piles because you have sex with other men. And it might not just be piles, it might be infected piles, which requires a different treatment from ordinary piles. So students, please do not be offended, because we cannot tell who sleeps with men, who doesn't. So if you have hemorrhoids, you might be asked such a question. One of the things we test is panic anxiety attacks, which are common during the test week and examinations. COVID-19. There is a health check that has to be done by staff and students. It's a health check that was developed by Hiv Health to allow students and staff to screen before they come to campus, so that we minimize people that have got symptoms for COVID coming into the university and creating a situation where we have an outbreak of COVID-19 infection. So it's important that you do this health check every day, whether you are studying in the residence or you come into the university. To access this, you have to download it. The details are publicized in most residences, but I can just say, if you're using the URL, it's healthcheck.higherhealth.ac.za, or you can add a WhatsApp number 0600 11 0000, and then https://wa./wa27600 query text equals hi, or you can dial, if you don't have a smartphone, you can dial a USSD line *134 *832#. We do not test on campus. We do not have the capacity to do that. We have not been accredited. We do not have the resources to do that. If you have symptoms for COVID, which I'm going to talk through later, please do not come to campus. Go to a nearest health facility for you to be treated. The MUC clinic is not accredited to treat flu symptoms. Even if you stay in the main campus, we are unable to treat you. We'll refer you either to the Gateway Clinic at Prince Mkhwanazi Hospital or to the D Clinic. Students, please do not cheat on this one, because if you come into the clinic and you've not done your health check correctly, and you have not stated the signs and symptoms of COVID, and when you enter the consulting room, you say now you have COVID-19 related symptoms, it creates a problem, because you've already been sitting with other students in the clinic, and you expose them to COVID-19, to the possibility of getting COVID-19. What is important, once you've been to the health facility, you need to self-isolate. If you stay in the residences, you'll have to tell your warden, so that you'll be sent to an isolation and quarantine facility, which is being rented by the university. until the symptoms have subsided, or if you had tested, if the facility tested you until your results come back and they are negative, then you can go to your original rest. There's a special residence that has been acquired by the university for isolation and quarantine. This is very important because once we have someone who's sharing with other people testing positive for COVID, by law, we are not allowed to allow students to stay together, because we're putting other students at risk because they will sleep. I don't think they sleep with masks in the residences. So it's important that you report this to your warden if you're staying in the residence, and then you can be moved to an isolation residence until the symptoms have subsided or your test result come back negative. For queries about COVID-19, there's a COVID email address for queries. It says covid_enquiries@mut.ac.za, or you can send a WhatsApp message on this WhatsApp number 081-796-0649. It's meant by Sister Gasa, one of the nurses in the clinic. Now, what are the common signs and symptoms of COVID? Many of you might have heard this: fever or chills, dry cough, sore throat, shortness of breath or difficulty in breathing. That one, if you have shortness of breath or difficulty in breathing, make sure you run to the closest health facilities. Fatigue, muscle pain and joint pain. I'm not saying you must ignore the others, but shortness of breath and difficulty of breathing is really a life-threatening situation, so you need to get to a facility as quickly as possible. You might have a headache, you might have loss of smell or taste, you might have diarrhea, you might have nasal congestion or runny nose, you could vomit or you could feel like vomiting. What to do if you test positive? If you stay in the residences, inform your warden, because then you will then have to be moved to an isolation facility as quickly as possible, because many students in the residences are sharing residences with other students. So it is selfish for you to stay with the positive results and not inform people or the warden so that you can be moved out. If you're positive, then you'll be sent to the temporal isolation facility that is administered by the university. And an arrangement will be made for you to go to the state facility, because as a university we are not accredited to have an isolation facility. But for an immediate intervention, whilst we're waiting for the state facility to get us a bed, we will put you in the isolation and quarantine facility. So in that facility, those that are on isolation will be separated from those that are on quarantine. Those on quarantine are those that have been exposed to COVID, but they have not tested positive. So let's be honest about this, because otherwise one case might lead to many cases if it's not managed properly, and then the academic work will be affected. What is also important, unless if you are too ill, you also have to report to your departmental administrator, because you will be away from classes, so that they know that they can make arrangements as to how you're going to get your work, and if there is a test or an examination, how that will be covered. If you have informed us in the clinic, we do inform your department without telling them what your medical condition is, that you're going to be away from classes, or you cannot write a test or an examination, and then the department will arrange accordingly. We request that you send a copy of the results to Sister Gasa at the covid_enquiries@mut.ac.za or onto the WhatsApp number. The Department of Health requires this results so that you can get a bed in their facility. But in the meantime, once you're getting that, because what they normally do, they send SMSs. So if you cannot get the results, you can give us a consent that we can request them. So we will need your reference number and we can request them on your behalf so that we have them. Also the VC, for him to notify the university about a COVID case, he stipulates that the clinic should have received the copy of the actual result, not the SMS. because we've had cases where somebody says I'm COVID positive, and when we try and find the test results, mysteriously they are not available. What do we do in a medical emergency? The university is contracted to CityMed. You can phone this number, it's a toll-free number, 0800 111 911. If it's during normal working hours, you'll be attended at the campus health services. But after hours and in the residences, you have to call that CityMed number. The future plan includes that we need to have first aiders among students, especially in the residences, so that they can assist until the ambulance comes, because between the incident and the time the ambulance arrives, a lot of things could have happened. So the intention is to train the warden and some students on first aid. We have a calendar for health and awareness program. You will see them, they get advertised. We've missed out almost the first part of the year. Currently we're doing HIV counseling and testing. We'll do a candle lighting memorial service because it's the month of May. It's a tobacco awareness month, so we might see posters and be advised if there's an event around that. So each month has a theme with regards to health awareness. The clinic times, Monday to Thursday from 8 to 1600, consultations between 8:30 and 15:30 on Friday, and 8 to 1300. Doctor's time is between 8 and 10. She only sees people that have been referred to her and the students that need assistance with a disability NSFAS application. The clinic is closed between 1 and 2 for lunch. We cannot afford to take turns because there's very few of us to say this one goes for lunch and the other one continues to work. Unfortunately, we have to close between 1 and 12. Our challenges include resources, both human and financial, and the untold expectations. There's many expectations from students that we are not aware of. Some of them we learn when they raise issues, but they raise them in complaints. I suggest that if you have expectations or if you have recommendations, speak to us before time. For COVID-19, there will be training online details, because what I've done, I just took the important things that I think you should know about. But there will be a detailed training which will be scheduled. It will start sometime next week. We'll be waiting the confirmation from the ITNN who's going to be setting up the time slots for us. Please do attend, students, because I would think there's lots of things that you might have questions on that you will be able to ask, because there's an interactive session. And when you attend, please use your university email addresses, because it is difficult for us to print a register and know who attended it, who had not attended. So use the university address, because you will be invited with the university address. Don't transfer it to your Gmail address, because we don't know who's whoever in the Gmail. Please use your university address. The intention is that we have a module on Kovid on the learning app of the university. But for now, we'll be conducting training. We'll have at least 3 sessions a day, starting from 10 to 11, another one from 12 to 1, another one from 2 to 3. Please do attend. Thank you.